think in 2024, there was a randomized control trial looking at walking, and they looked at walking specifically for lower back pain. And what I liked about this one, this is from Norway, which was kind of where I was just at. I was just in Finland. But they analyzed 11,000 adults. It was a population-based study, and it was published in JAMA Open Network, so reputable journal. What was interesting with them is they looked at the group of patients that walked the most had a 23% lower risk of developing chronic lower back pain. So when I looked at it initially, it said effectively walking more than 100 minutes per day, they had a 23% reduction in chronic lower back pain. Now,
That's a lot of walking.
yeah, that's what I thought at first. And so they said, but even in walking 78 minutes per day, they had a 13% lower risk of developing chronic lower back pain.
So hold on, wait. 78 versus 120?
Versus 100 minutes per day.
100.
So,
Well, it's not.
so when I looked at it, I said, well, what was the breakdown in terms of intensity? And that was what I liked about the studies. They said basically those that walked at higher intensity, they saw benefits, but they were less pronounced. So what they were trying to say is just movement in general is good to prevent chronic lower back pain, specifically walking. And so basically they're talking about the volume of walking being important, not just the intensity for chronic lower back pain development. So for me, I know one big key component for my home exercise programs is I have my resets or my pain modulating movements that I like to do. I then have those kind of core stability or exercises that help give good positive inputs to those muscles, whether it's isometrics or bridges or squats to re-educate function, like for getting on and off the toilet and things. Then I also, in my home exercise program, especially because I take that lifestyle approach, I also look at walking in general as a positive. And so I oftentimes put that on there, like you should be walking 10 minutes several times throughout the day. And I know a lot of my patients are like, I don't know why you put this on here. This really isn't an exercise. And I'm like, you'd be surprised the evidence on walking, particularly for not only acute lower back pain, but for preventing chronic lower back pain